Hey, Libby. I just wanted to go over this case with you. You had just sent me from Megan. This is where you are now. As with any case, I always like to come over here, add to comparison. I want to see where they started so that I get a general sense of, compliance of tray wear, degree of predictability of tooth movements, and what have you. So never looking at just where you are, but always looking at where you were as a way to draw some conclusions. Um, my bet is you've already been doing this. I just want to make sure that it's not something that was overlooked. The first obvious thing I see is the attachment here. I'm not sure who placed them. If this was you, let me know. I will show you a few tricks on how to prevent flash. But it's very possible that this upper tray wasn't even seating down all the way because of the extra flash that was here. Under ideal conditions, there is no flash. That is what the subsequent trays are expecting. This one looks very good, and there's reasons why this one is good and the others aren't. Um, let's talk in person about that. But ideally, after the button is placed, all of this flash is removed. And there's different ways for us to reduce the flash from being there in the first place. With that said, um, I do think that the extra flash might have something to do with the lack of tracking here, but I don't think it's 100% the reason. And I say that just based on experience. So my first question, and this is something you should know before any Invisalign case, is what are the patient's treatment objectives? So I'm going to assume this patient showed up and she didn't like the space here. If we look at the lower teeth, there is a exaggerated curve of SPE. I doubt the patient necessarily wanted to fix that. That's not something I typically see patients wanting to fix. My guess is that it was this space here that bothered her. The teeth didn't really look like they were rotated or malaligned. Then again, this patient is skeletally class 3, so maybe you had a conversation with the patient about building a better occlusion. In which case, let's have that discussion about, what the goals were and whether or not simple Invisalign was necessarily the tool to get her to a better place that didn't have other symptoms. So if you can share with me what the patient's treatment goals were and what your treatment goals were. If perfection was what we were looking for, then yes, we still have spaces to close. But I'm really concerned that she hasn't closed much. So I do think that there's probably a high likelihood here of patient noncompliance. And it's difficult to call a patient out when they say they wear their trays all the time. Building the value in the eyes of the patient at the beginning and at each recall exam is the art to the success of Invisalign. So I think what I would do here is really try to get a sense of how often she's wearing the Invisalign trays. Yes, one could say that you were able to close, 8/10 of a millimeter. Trays that don't fit very well still translate teeth. So I'm not surprised that you saw some resolution with the spaces that are here, but your email said you're having a problem continuing to close the gaps. I have no doubt that if you get rid of some of this flash and help the patient wear the trays more, that closing these spaces should be pretty easy. And also, she has closed the space, there has been progress, so bringing light to that. So I wouldn't beat yourself up over the fact this is the third round. Some teeth translate more slowly, and I always tell patients the number of refinements is not something we can promise because it's greatly dependent upon a computer guessing on the biology of the patient. There's going to be some wiggle there, and sometimes that translates into extra refinements. So don't worry too much about that, but just know that the conversation with the patient in the beginning is super helpful to get you there. Other than that, I think if you do another round of trays, you're going to be fine. I'm a little concerned about maybe some potential entrapment because of her skeletal class 3 situation. And really just trying to get a sense of what the treatment goals were. I'd probably assume that you weren't going to unravel this tooth and crossbite, but your note should have something to the effect of this was not a treatment objective. risks and benefits discussed with the patient, so on and so forth. The last thing you want is for this case to end up in somebody else's perspective, and then they say, well, why didn't that get addressed? But I think your goals were to close that space. You're not getting a whole lot of resolution here. You can close that with composite pretty straightforwardly, and get the patient to where they need to be. Again, it really depends on what the goals of the treatment were. Keep in mind, extrusion of laterals is one of the hardest things to do with Invisalign, if that was one of your goals. Reason being, extrusion with any Invisalign treatment or any clear aligner therapy is very difficult. But laterals have such little surface area of tooth that the tray doesn't have enough surface area to interact with the tooth to exert the extrusive forces necessary. So always kind of build that into your plan. Maybe educate the patient on extrusive elastics. It works extremely well if you take an elastic and put it onto the canine. The canine has a much larger root than the lateral. You put the elastic here and you'll get quite a bit of extrusion here. You can do that as a standalone movement. You can also do that as a way to support the tray exerting extrusion. So a supportive elastic would be one way to think of it. I have put a button on the lateral to help support it, to create a triangle. It really depends on what your goals are. So hopefully that helps. Let me know if I missed the point here. But I think just getting better control over the flash would probably be the biggest takeaway message here, and then ensuring patient compliance with tray wear. All right, let me know if I can help any further.